Many people are finding themselves in a catch-22 situation these days. They desperately need to have gastric bypass surgery, but they can't get it since they either don't have insurance, or the insurance that they have doesn't cover the cost. There are real benefits to the surgery, and for those people who are suffering from severe obesity-related health issues, the need is even more urgent. This article will show you what the cost of gastric bypass surgery is, which may make it easier for you to decide on the best course of action for you and your health. Unfortunately, insurance companies seem to be run primarily by short-sighted bean counters, people who only look at the bottom line and won't consider any procedure that will cost money. When it comes to gastric bypass surgery, this short-sighted approach is actually costing the insurance companies more money. Why? Because they will be paying to treat diabetes, heart disease, stroke, and many other obesity-related illnesses for many years. By approving just one gastric bypass procedure, they could be dramatically reducing the number of claims they get for the other obesity-related illnesses. One word of caution: don't automatically assume that your insurance company won't cover the surgery, particularly if you are morbidly obese and have been for many years. Many companies will also do a complete physical and emotional workup before making a decision on whether or not to allow the procedure. More and more insurance companies are coming to understand the benefits of allowing this type of surgery. Make sure you check with your company. The cost of the surgery can range from between $15,000 and $25,000. Some clinics who perform the procedure will allow the patient to set up a payment plan. Again, it's important that you don't assume anything and instead ask the question. Some people are also having success by going to other countries, such as Mexico, to have the procedure done. In some cases, well-qualified doctors can perform the surgery much cheaper in other countries due to the fact that they don't have to pay the ridiculously high malpractice insurance premiums that they need in the US to protect themselves against frivolous lawsuits. If you opt to have your surgery done somewhere else, it's very important that you carefully research to find a highly qualified doctor and clinic to perform the procedure. While it's possible to save some money, you want to make sure you aren't sacrificing quality or safety. The bottom line is this: the cost of gastric bypass surgery can be high, but if you are morbidly obese and are suffering from a multitude of other health issues, you should try to do everything possible to get your weight to a more normal level. Make sure you ask questions and don't just assume that you can't afford the procedure. You may be surprised at some of the help that is available. Your employer may even be able to provide some help with this issue. Just don't give up, keep working on ways to improve your health.